We are here at Renovus Medical Spa. I am joined by Dr. Clemons and Megan and our lovely patient here. We are talking all about microneedling and stretch marks. And Dr. Clemons, welcome back to U.S. after you were in India talking about microneedling.
Right. I went there last week, and we were actually doing microneedling and teaching how to do that over there and how they could use it in acne scarring. And stretch marks are a type of a scar.
Right.
And you don't think about that being able to treat it with the same thing we treat scar treatments with, but microneedling is a phenomenal way to do.
Right, and when we think of microneedling, at least for me, I think about something that you do on the face. And like you said, some people may have acne scars, but stretch marks, people have it on different parts of their body, and that's where microneedling can come in and help.
It's a wonderful treatment for that. We've treated areas on the arms, on the breast area, on the sides, and you see in the thigh area, abdomen. It's just beautiful, beautiful results. And no pain, no downtime. And let Megan go ahead.
Yes. So tell me a little bit about what Megan is doing right now.
We numbed the area about an hour ago, putting a cream on there so it really doesn't hurt. It's nice and numb. And we've got a gel there. And what she's doing, she's got a series of 36 needles in a little cup, and they're going up and down rapidly. And so they're making little tiny holes in the skin, so we're actually needling the little scar areas where her stretch marks are. And then she'll go through a healing phase where she's going to bring in new collagen and new elastin and new tissue, healthy blood vessels and whatnot. And so these will actually be repaired.
Right, and so we're looking at the thigh area right now, but there are stretch marks on all different parts of the body, and they can be different colors, and that's why people need to come in and talk to you about what's best for them. Exactly.
Most areas of the body we can treat. Some areas we look at and we figure, well, maybe 1 or 2 treatments. Other areas we'll look at and say, you're probably going to need 3 or 4, depending, and everything. And again, males or females, and we've treated most areas of the body.
Wow, that's great. And so tell me a little bit, so you mentioned multiple treatments usually help out, but you can see results after the first treatment.
Right. We have them a month apart and no real downtime afterwards. So when you come back for your second treatment a month later, we can see a significant improvement at that. We usually patients come back for their second treatment, they've got smiles on their face and they can't wait for another treatment.
Right. Well, and we were talking to not only can you help with the thigh area, but you mentioned the stomach, the breast area, even the arm area too. So smaller areas, this helps out a lot.
Right. Look at the time of the year we are right now. It's swimsuit time. It's shorts time. You've got a lot more skin exposed, and it's an embarrassing thing when you have these bright red stretch marks, or even the white stretch marks. It can be very, very embarrassing when you're out. And by doing this, you're not going to have the problems with it. And now's the time to get going. A month ago would have been better, but now's the time.
Right, exactly. And you can get a head start on those treatments, but they need to come in and talk to you to figure out what is best and what's the best plan for them.
Absolutely. As always, our consults are free, and we'll talk, we'll look, we'll tell you. And if you're not a candidate, we'll say you're not a candidate, but there are not many people that would not be a candidate. Right,
exactly. And you can come and talk to Dr. Clemons. Give them a call today. Learn a little bit more about microneedling and how it can help you out with those stretch marks and all those places, because like Dr. Clemons mentioned, it is swimsuit season. We're going to be out in shorts and swimsuits later on in just a couple of weeks. Dr. Clemons, thank you so much. We appreciate it.
Oh, thank you. And Megan, thank you.
The preceding portion of Daytime Tri-Cities was sponsored by